All right, now I'm recording as well. All right, well, it looks like we've stabilized this, well, pretty close, the number of participants there. So I guess we'll go ahead and get started. Again, my name is Matt Mustakis. I'm the Executive Director of Risk Management at Texas Women's University. We have a number of other panelists who are in the wings, so to speak, that will be helping me answer questions as we go. If you missed me saying it, there's a Q&A function you will see in the Zoom app. If you could use that, excuse me, if you could use that to respond or to submit your questions so we make sure we answer them properly. What I'm going to do is we're going to go ahead and start with our presentation, and then at the end of that we'll have our Q&A session. Hopefully everyone can see my screen. What we're talking about is the proactive testing program, as we're calling it here at Texas Women's University. We're going to cover the current situation. We're going to talk a little about vaccines, then the specifics of the program, excuse me, and then of course we'll do the Q&A session for most of our time. So I'll go ahead and get started. I'll try to at least. There we go. So the situation, as you probably all know, we're back to full capacity in our classrooms and other events on campus. While we can't require masks, they're strongly encouraged when indoors, especially when you're around others. Vaccines, of course, are strongly encouraged. We can't require those either. And as I'm sure you all know, the Delta variant is causing a surge in cases. Facing this landscape, Texas Women's University continues to take a conservative and layered approach. And that's going to be important for the rest of the discussion. What do we mean by layered approach? Basically, we have a number of preventative measures, and this picture is a good illustration, none of which are 100%, right? But having multiple layers on top of each other helps us to protect the TW community. So you see on this, we have staying home if you're sick, masks, fast and sensitive testing, contact tracing, quarantine and isolation, and of course, vaccines. We'll talk about that again another time here, I'm sure. So let's talk about vaccines, right? There's Governor Abbott getting his vaccination. A couple quotes from Governor Abbott. I'll never ask any Texan to do something that I'm not willing to do myself. And he also said that vaccines are the surest way to end the pandemic. You know, Governor Abbott certainly encouraging you to get vaccinated, even though he has decided not to allow state agencies and universities to mandate them. But he and any number of public health officials are encouraging vaccination. So why are we even talking about vaccinations while I'm presenting about the testing program? It's really twofold. One, we're still encouraging all faculty, staff, and students to get vaccinated, of course, but also the efficacy, how good the vaccines are preventing the disease, very much informs why we're doing the testing program the way we're doing it. So let's talk a little about that. So the efficacy, vaccines are remarkably effective. Originally, the goal of the vaccines was to really prevent significant disease, hospitalization, and death. And they were dramatically more effective than that. They stopped almost everything, you know, as far as symptoms. And serious side effects are very rare. This statistic you might have seen, Texas, those who are vaccinated as a percentage of all COVID hospitalizations, this was mid-August, this data, is about 0.2%. And as a percentage of all COVID deaths is like 0.4%. Right. So yes, you can still potentially get COVID after being vaccinated, but it is very unlikely compared to being unvaccinated. There's actually a new study out of the Pfizer vaccine versus the Delta variant, indicating that it was 96% effective in preventing hospitalization and 88% effective in preventing symptomatic cases. We bring that up because there was some concern that with the White House and others talking about booster shots, that maybe the efficacy had dropped off significantly. And the evidence currently is that it hasn't. And there's some debate whether there will actually be booster shots in September, like was originally announced. At this point, that's probably pushed back until more people get vaccinated in the first case before we do boosters. But let's talk briefly about, we had a question in the employee town hall actually about Moderna vaccine. There is an unpublished study that has similar results, but again, that hasn't been peer reviewed yet. So breakthrough cases. As I said, you can develop COVID after being vaccinated, but it's much, much less likely, right? You're not as nearly as likely to become infected if you've been vaccinated. It's hard to know exactly, but the estimates are.
We have 34 people.
34.
And I bet
Deanna,
we were joking this
Deanna,
morning because they had 20.
Deanna.
Like, how many panels do we have?
Okay. Okay, sorry about that. So breakthrough cases. So the estimate is about one fully vaccinated American in 5,000 will contract COVID per day. Even less than that when you're taking precautions, right? So maybe closer to 1 in 10,000. This next concept, there was a lot of news reports about how those who are vaccinated but then have a breakthrough case, who become infected, the viral load, in other words, the amount of the amount of virus in your nostrils, in your throat, in your lungs, is the same as those who are unvaccinated. Well, while that's true in the initial days, because you have an immune response to the COVID virus, those numbers drop off way more quickly in those who are vaccinated than those who are unvaccinated. So again, we're talking about vaccines in part because it very much informs how we're doing our contact tracing. And what I'm saying by saying that is that you're a whole lot less likely to get COVID and thus less likely to transmit it if you're vaccinated. In addition, even if you do get it, the viral load is that much lower, and thus another reason you're even less likely to transmit it. So moving on. So I do want to talk briefly about the Community Immunity Challenge. You may have heard about this already. This is our way to encourage students and employees to get vaccinated. We have prize drawings that'll be unlocked at various rates of vaccination. So there's an employee contest and a student contest. For students, we're at around 65% vaccination rate right now. What you need to do is provide proof that you're vaccinated, and there's a link to do that at twu.edu/immunity. Provide proof that you're vaccinated. And when the entire student population hits 70%, 80%, and 90%, then there will be a bunch of prizes that will be unlocked and drawings. And anyone in the student population is eligible, not just those who submitted something, but obviously it's a team effort. So go ahead and submit your proof. We're giving away a lot of money in scholarships, in campus bookstore monies. Yeah, we're giving away some MacBooks, parking permits, other electronics, iPads, and some smaller prizes like graduation, commencement gear, and stuff like that. So sign up. There will be additional opportunities on campus to get vaccinated this semester. In conjunction with the testing sites, we're going to have certain days where you can just go to the testing site and get vaccinated as well. And we'll be announcing when those dates are. But Student Health Services has some currently, and we'll continue to make that available to students as it's available. Okay, so let's talk about the program specifics, this testing program. The proactive testing program, as I said, we're calling it, is a COVID-19 surveillance testing program. This requires that all faculty, staff, and students get tested each week, right? And it's each calendar week. Testing locations are available on all 3 campuses, and it starts September 13th. That's this Monday. There are some exemptions, right? You provide proof that you're fully vaccinated, and you do it in the same way that you do for the Community Immunity Challenge. Fully vaccinated individuals can still get tested if they want to, right? So if you see the test facility there and you're wondering, feel free, even if you've submitted proof of vaccination for the contest. You don't have to get tested if you didn't come to campus for any time during the week. So you're either fully remote or you just didn't come on campus the entire week, then or you're sick or whatever for that week. You don't have to do it then. But if you come to campus for any reason, at any point during the week, you do need to get tested. The other exception would be if you had a positive test, a positive COVID test, within the last 90 days that has been reported via the COVID-19 reporting form. This is the form you use when you've been exposed or you had a positive test, you feel sick. It's the same form. We just want you to make sure you report it that way so we know that you really did have a positive test. It's worth noting that having a religious or medical reason that prevents you from being vaccinated does not exempt you automatically from being tested. So you will have to actually have a separate review process for that. So if you're a student and you feel like you should have an exemption from testing, email Dr. Stephanie Krauth at skrauth@tw.edu, and she'll give you access to the exemption form for that. Enforcement. So again, you must be tested once each calendar week unless exempted as noted above. Students who do not get tested will be referred to the Office of Civility and Community Standards. So what's the actual process? So appointments, I say, are required via online portal. I'd say that's strongly encouraged. It's possible that you show up at a time when they're not busy and can get in. They're still going to make you fill out a form that you could have done online. So it's better to just do it online and have an appointment so you know you're good to go. Do you need to bring your TW ID with you? The testing itself is a rapid antigen test conducted via a shallow nasal swab. So if you experienced the deep nasal swab, they tickle the back of your brain, that's not this. The little diagram shows about how far they go in. You go and just swirl around for 15 seconds, on either side. You will be asked to wait 15 minutes to receive your results, so you'll know right then if you're positive or negative. If you do test positive, you'll be offered a PCR test for confirmation, and you must immediately return to your place of residence and report that positive test via the COVID-19 form I mentioned earlier. Privacy concerns. Going to the testing location does not mean that you're unvaccinated. So just because somebody sees you waiting in line, let's say, that doesn't mean they automatically know you're unvaccinated. There are plenty of folks who are going to be going to get tested just because they think they might have had an exposure or just because they want to every week. As I said, those who are fully vaccinated and either haven't bothered to turn proof in or have and still want to get tested are able to. The testing process will be arranged so others won't know your test results. In other words, it's not like everyone who tests negative will go this way and everyone who tests positive will go this way, or they don't hand you a red sheet of paper or anything like that. Test results and the vaccination status is handled in accordance with all applicable privacy requirements as well. Okay. So locations and times. This is the current schedule, and this is subject to change because we're going to see how this works, make sure that everyone can get tested who needs to. But for right now, we're going to start with this, and we'll put updates on the website as necessary. But in Denton, this will be the Brackenridge Hall Underground. This is the former Student Union, where the former food, if you're familiar with this, the dining facility used to be down in the basement, but it's the basement of Brackenridge Hall. That's 6 to 3. So 6 a.m. to 3 p.m. Monday and Thursday, and then 9 a.m. to 6 p.m. Tuesday and Wednesday. So we're not doing it on Friday just because there's less activity on campus. Same with Dallas. This room 1501, that's the it's the one stop in the front lobby there. And 9 a.m. to 6 p.m. Monday through Thursday. And then Houston is room 2305. That's the seminar room, but there'll actually be some waiting outside on they refer to it as the bridge and the hallway outside. We're going to make sure that this is socially distanced so that if you're sitting near somebody and they end up testing positive, we don't have to do contact tracing on everyone who's sitting near that person. So again, that's 9 through 6, Monday through Thursday. Okay. Well, we are at the point where we do the question and answer session. I will throw up a number of helpful links. The appointments, they're going to be at tw.mycovidappointment.com. Unfortunately, that isn't actually working yet. It will be later Sunday. I fear that that's going to come online, but that's the address. You can upload your proof of vaccination at tw.edu/immunity, as we mentioned, and then a couple pages about this program and its details and a frequently asked questions as well. So, questions.
We kind of got one question that's similar to this one, but I figure I'll throw it out because it was asked a lot yesterday. Can you be tested by outside providers?
Yeah, so we really prefer that you do it on campus. It makes it a lot easier for you and for us, obviously. But if for some reason you need to or need to get tested off campus, that's fine as long as it is a test that results in a report with your name and the date and the results on it, right? So it can't be an at-home test that you do by yourself. It needs to be, go to CVS or Walgreens or something like that and get a test from a place like that.
And then someone just asked, if we are working fully online, does TW know, or do we need to indicate this somewhere?
Yeah, so unfortunately, presumably your supervisor knows, but yeah, at the level of all employees, when we're setting up this program, we don't know that. So the way this is going to work is that we'll get a report from the Gene IQ, that's the name of the company who's doing the testing for us. They'll send us a report of everyone who didn't get tested over the course of the past week. And then that information will be sent down to the various supervisors, and supervisor will go, oh, well, this person works remotely, so that's not a problem. So that's how that'll work.
Does that also work for students who are fully online?
Yes, sorry, I got into employee mode there. Yes, same for employees. Now, students are a little easier, actually. Students, we're hoping that the list of students that we're providing to the contractor will exclude those who are fully online, but it's possible that we'll have missed somebody for various reasons. So when that list gets to Student Life, and if they end up texting you and you're like, hey, I'm completely online, just let them know that, in case we get you in the wrong category. So no, you don't need to indicate in advance, is the short answer.
Gotcha. Someone just asked, when someone is on campus who has or who had a positive COVID test and you find out they're vaccinated, what happens next?
So whether you're vaccinated or unvaccinated, if I understand the question, you will, if you test positive, no matter what your vaccination status is, Gene IQ, the testing company, will give you instructions, which will basically boil down, you need to go home, you need to start isolating, and you need to report it to TW contact tracers. And then we'll follow up and talk to you through the 10-day isolation period and how to let your professors know and all of that. Does that answer the question, I hope?
I believe so. I don't know if it might be helpful. Matt, can you go back to that cheese slide?
Oh, yes.
And kind of re-explain that layered approach?
Yes, I am more than happy to, if I can make my computer cooperate. Oh, well, that's not the way to do that. Hold on. We'll just do it this way. All right. Yeah, so again, there's a lot of concern about the testing program specifically. It's not 100%, you don't test everyone, all the criticisms that are valid, but it is only one preventative measure among many. Right. So we're encouraging masking. We're, doing our contact tracing. We're doing quarantine and isolation, ventilation to outdoors and air filtration is mentioned here. We've tweaked the HVA systems on campus to make them incorporate more fresh air. Again, I mentioned masks and staying home if you're sick. All of those things are effective to a point, but not 100%. And testing is the same way. But because we can't require masks, because we can't require vaccinations, because we've returned to full density, because there's the surge because of Delta, we need additional preventative measures. So hopefully that makes sense.
And if I can jump in, there's still some more questions on it. So if you picture the cheese slice and as far as vaccinated versus unvaccinated and why only test the unvaccinated. So each one of these, right, you don't want the holes in the Swiss cheese to line up. And so for unvaccinated people, based on the statistics, you could picture the hole in the cheese being about 80% vacant, a really big hole, right? So we're trying to shrink down that hole. If you picture that hole for a vaccinated individual, you only got about 20% of the hole exposed. Right. So that's why, and so we got to,
and I would argue that if you look at this diagram, you're missing a slice if you're unvaccinated. And I don't mean that in a negative connotation. I'm just saying that's one preventative measure that you individually don't have to protect yourself and others.
Right, and we're trying to shrink that hole down that for the unvaccinated based on the data and from the CDC. So that's why there's to kind of get it to that same level so that those that don't want to get vaccinated don't have to, but we can still protect the TW community at similar levels. And
I will say, this is not an approach that TW made up in a vacuum. This is very common at other universities, even the NCAA specifically takes this approach with student athletes who are vaccinated versus unvaccinated. Yeah, statistics still show vaccinated people are spreaders. Okay, that is a common, yeah, you can, as a vaccinated individual, catch and spread the virus. It's just much less likely, and you're infectious for a much shorter period of time. So when we're trying to figure out how to best use our resources, this is how we've decided to do it. And again, we're just trying to do our best approach, do our best to combine the various approaches to, use our resources wisely, as I said, to protect the TW campus.
I saw a question that's kind of similar to this one, and it was asked yesterday. But if you have been vaccinated, can you still be tested on campus?
Yes. Yes, sorry, I thought, yeah. That is definitely anyone who wants to get tested and has a TWID. We had a question last time, can I get tested every day or something like that? Well, we prefer you not do that. I mean, it is using university resources. But, if you got tested, or sorry, if you're fully vaccinated, but you're worried because you went to a family reunion and it turns out a bunch of people tested positive there, by all means, feel free to do it. We encourage that. It's an interesting question. There's many articles reporting how being naturally immunized is just as if not more effective than being vaccinated. Actually, what we've seen is that if you were sick earlier in the pandemic, it is not as effective against the Delta variant as being vaccinated. So that does actually come into play in our considerations.
Matt?
Yeah.
Wasn't there also something you mentioned yesterday that when you have antibodies, you don't necessarily know what the antibodies are from?
Yeah, so if I don't know if we got that question, but we had gotten several questions about antibodies. Hey, if I bring the report from the doctor's office saying I have a high level of antibodies, can I be exempt from this? And the answer, unfortunately, is no, because we're not sure how long that immunity lasts and how it correlates to how many antibodies are in your blood. And we don't even sure, to be fair, if other coronaviruses, not COVID, but their siblings like SARS or something, they may also have that same response. I'm sorry, the antibody response might be similar, I'm trying to say. So CDC does not recommend using that as any kind of clearance. Let's see here. There's an interesting question. I'm not sure. You keep saying the phrase test positive, but neither the antigen test or PCR test is binary and results are based on a precedent. Yeah, I mean, we're using tests that have been approved by the FDA. I mean, I couldn't get into the, X number of counts means positive versus negative, but since it's been validated by the FDA, that's what we're going with. Why is testing not optional? Again, we have the ability to require faculty, staff, and students to be tested, and we don't have the ability to require some other things. And so, just like making reporting that you have a positive case or you've been exposed mandatory, it's a tool that we have available to us, and we're having to take advantage of it for the good of the community overall. What other ones I'm missing here?
There was one that just came in about, I think you might have mentioned it, but false positives and false negatives. And so there's the confirmatory PCR testing. If you test positive for via a rapid, then you have the option to right there on the spot get a PCR test for confirmatory testing.
Yeah, and our understanding is that with the rapid tests, which we're using for speed primarily, is that when you're positive on a rapid test, you're very confident that that's a positive result. There are more false negatives with rapid tests. However, this is why we're doing weekly testing. And also the requirement that you report any symptoms or exposures you had. So again, it's a multi-pronged, multi-layer approach to try and identify those who could be infectious and put them in isolation or quarantine. So we're not relying on just one thing. You know, we could do PCR tests, but again, we've got to do what makes the most sense. With a PCR test, for example, one of the big downsides is it's, you know, at least 24, probably more like 48 hours plus. And so that person, yes, we might have a more accurate result, but the positives we wouldn't know about until they'd gone to class for several days, potentially. So this is the approach we decided to take. So it's an interesting question. Why is it that a country like Israel, which has very high, exceptionally high vaccination rates, is still seeing so many new cases, while countries like Sweden, which went to natural herd immunity approach? So actually, it's interesting. Both of those cases aren't turning out like they originally thought. Israel, right? They got vaccinated early, but and quickly. But now there's some question about what it means that Delta is still causing a surge, right? Originally, and that's part of the reason the White House was talking about booster shots, they're like, oh, it must drop off significantly. But that Pfizer study I mentioned earlier kind of disproves that. So we're not 100% sure what's going on with Israel. And the same with Sweden. Sweden was being touted as a great example of, look, you don't have to do all this. But then they started surging afterwards as well. So I think it very much varies from location to location. And everyone wants to kind of think of it like as one big curve. And each area has a different set of circumstances, has a different trend line, and it's really hard to know if those are even comparable, right? So we follow CDC and local and state guidelines and track the data as to what's going on locally and how we respond. But let me just say, the herd immunity, just letting everyone get sick, yeah, I mean, that would work eventually, but at a much higher cost of life. Okay, I am catching up here. Any other questions? Considering the current stats from the CDC that 75% of Americans have either been naturally immunized or immunized with the vaccine, it seems as though they look at it as though it is equal. No, I mean, that statistic, they're saying there's some level of immunity in that percent of the population. And I don't know if that statistic's accurate, but when I have seen that statistic, it's that, you know, there is some level of immunity in 75%, whether you were exposed, whether you got one vaccine, whether you got two vaccine, but there's no question that fully vaccinated is the most effective, right? Even those who don't want to have the mandates, even those who, you know, like Governor Abbott, there's no question that that is the best way out of this pandemic is vaccination, not natural immunity or herd immunity.
And there's also some decent evidence in papers that the vaccine will induce a higher T cell response, and T cells are longer lasting versus just antibodies. Antibodies tend to wane more quickly, and so the vaccine will give those T cells that can. There's some indications they could last for years with some other, not with COVID-19 because we haven't been dealing with it for years, and so, but they're finding that it is longer lasting than natural immunity, which is why that 90-day time frame is there.
and I will say, we are not doing this analysis in-house, right? We're deferring to, again, CDC, health departments, looking to our peers at other institutions in Texas and across the country, and trying to adapt what they're doing and what they recommend to what works for our community. So it's not a one size fits all. Obviously, this is new, so there's still new scientific data all the time that we have to pay attention to and try and keep up. That's why Dr. Faden always talks about being flexible and fluid. I mean, the situation keeps changing and the guidance keeps changing, and we're just trying to keep up, do our best. All right. Well, I don't see any other questions unless I'm missing some. Is any on the, so a question for Dr. Krauth. If a student is expected to participate in the COVID-19 weekly testing program and chooses not to, they'll be sent several reminders and then be referred at some point to the Office of Civility. I mean, I would argue that that will happen if they just decide not to do it. They will be eventually referred to the Office of Civility. That is exactly the process.
Yeah, Matt, I think that was just a copy and paste of Stephanie's answer.
Oh, sorry. Well, good then.
I'm not sure why.
And yes. All right, well, we answered that one then, I guess. I thought it was aimed at Dr. Krauth versus, okay. What consideration has been given to the potential HIPAA violations in accordance with guidelines to share medical information? So we have a contract, obviously, with the GeneIQ, the test provider, that they are going to comply with the various privacy rules as applicable. And information that's shared from Student Health Services as far as vaccination information is covered by a HIPAA specific agreement as well. So we're doing what we need to make sure that the privacy is considered. Let's see, I think I did that one. Nope. Okay, so a question about the prize winning inventor of the PCR test. I don't know anything specific about the person you're mentioning, but the PCR test has certainly been validated for this purpose and is FDA approved. So I'm going to defer to them. I mean, we certainly haven't delved into that. It's like one of these, again, it's one of those questions where we're not the experts. So we defer to those career public health experts to tell us those things. If the FDA says the PCR is the best test, the gold standard, well, and then we're going to take the word on it, because we certainly aren't going to have that knowledge. The PCR, I mean, again, we're not going to get an argument about it. The PCR test is the most accurate way. Again, not going to be perfect, just like we talk about the various preventative measures. It's not perfect, but it is the best for testing. But again, we're only using PCR for confirmatory testing anyway. So it would be a rapid and a PCR both being positive, and the chance of those both being wrong for a positive case is virtually nil.
Yeah, and I would just, viruses are strands of DNA and or RNA, and the PCR is looking for those very unique sequences of DNA and RNA and amplifying it. And so, and it's very specific to the sequence of COVID. So yeah.
Yeah.
Very reliable.
I mean, again, is it possible to have false negatives and false positives? Absolutely. But for the PCR, very small chance. Again, I've got the cheese It's nothing's 100%, right? So we layer as many preventative measures as we can, as we're allowed to, on top of this, to control this pandemic, I should say. And I think we've been fairly successful so far. We've had the situation has changed and this semester than in previous semesters. And so we've had to change our approach. As this surge hopefully tapers off in the near future, we can start reducing some of these preventative measures. That's our hope, at least. How will TW help and support students who may get injured physically or mentally participating in this program? TW is certainly the campus with a heart, right? I don't expect there to be any injuries from this program, but if it happens, we'll deal with it when it happens. We still have a lot of time left, but I feel like the questions are tapering off at this point. We'll give you a couple more minutes if anyone wants to stay on and talk about it. Again, I'm going to go back to the end slide here and make my pitch for, why is it? Oh, okay. Make my pitch for signing up for the community of immunity. It's around $200,000 worth of scholarships, prizes, etc. All you got to do is help the student community reach certain goals by uploading information, your vaccination information. Obviously, we're encouraging you to get vaccinated. And I've said it several times already. It is the best way to protect yourself and to protect the TW community. And you can avoid getting tested as a side bonus.
Matt, a question about the community for immunity.
Mm-hmm.
Is there an expected date of when like our thresholds are being met, or when do we expect to see results from that?
So the contest basically runs to the end of the semester. And if we haven't hit the percentages by then, it's just over. So we may not give out all the prizes if we don't reach our goals, basically.
Will we get, I guess, like weekly updates, or where can students and like the TW community, is there anywhere online where they can see our progress?
We actually were talking about this today with Marcom. We haven't made a decision yet. We don't want to do like every social media post or whatever, or have to update it every day or anything like that. But we will provide periodic updates, and via social media and other methods. So I don't know what the schedule will be offhand. The conversation was in part, how do we encourage this by providing that information occasionally without boring people? So. The question about, Dr. Brown's already answering, basically about how it ends. Wow. In the name of public health, is TW going to take a stand on dating apps like Tinder, Hinge, or Grindr? I have no idea what that means. Social distancing and masks are always good. Clearly, I'm too old to answer that question. Is there a way I can review the literature sources you all use to make the decisions? I would recommend just going to the CDC, FDA websites, but we also look at modeling data as far as trends, obviously the state and county health departments that we operate in. As far as some of the more recent papers, like the one about Pfizer and the Delta, I couldn't give you the URL for that right offhand. I would say just Google it, and it's out there. I know MIT was talking about it recently, as well as other universities. So. Drew, I've got a one here that says that you were going to answer live. Did you already do that?
I did, yes.
Okay, it's still up there. I don't know how to say it's been done. All right, any other question? Oh, sorry. Did I hear correctly that professors will be notified of our private health information, a positive COVID test, if our workforce is testing this program? So when you test positive in a class, we do reach out to the professors in order to notify those who were within 6 feet of you, so that they can go into quarantine and thus be protected and stop the spread. But that is absolutely permitted. So it's a necessary side effect of contact tracing, and that's how all contact tracing is done. Yeah.
Matt, I think also the question there, and I think
Mhm.
part of the answer is that there is no shame in testing positive. It's not like
Absolutely.
it's your fault that you
Yeah.
tested positive at all.
Yeah.
There's never any conclusion draw about that. On the contrary, right? I mean,
Absolutely.
people feel bad if you test positive. So
No, I agree.
really just so you can do the contact tracing and the professors are aware, but there's absolutely no blame whatsoever.
Right. Yeah.
Testing positive.
This isn't like you have a medical condition that's a genetic condition or something like that. It's something that's transitive and not your fault, and we just need to protect your classmates and potentially the professor.
So it's not, so the professors are not really notified of private health information, only whether
Yeah.
someone's been tested positive.
Yeah, I would agree. It's not the same as, let's say HIPAA covered information. So the question about the student demographic, the survival rate is a high percentage. Why it takes such extensive measures to single out healthy individuals? We're not singling out anybody. We have a program that again requires all faculty, staff, and students. And again, for the student demographic, I mean, we have older students, but certainly we have professors. We have students who have health conditions that you don't know about. I mean, there are plenty of sensitive, or I should say high risk individuals within our population. And we're trying to protect the entire TW community. It's good if you're young and healthy and are low risk, but that's not everyone in our community. So it's not about singling out anyone. Like I said, we are allowing some exemptions, including those who are fully vaccinated, because they are much less likely to catch it and to spread it. And that's all it is.
Matt?
Yeah.
It might be useful to reiterate again that testing alone and testing one way, positive or negative, is not at all revealing whether you've been vaccinated or not, and that there's
Exactly.
no repercussion for that at all. Vaccinated people will be testing as well, and so the result of the testing doesn't say anything about your choices of vaccination.
Yeah. Just like being in line at the testing location doesn't really be anything. You may have just decided not to share your vaccination status. That's fine. The default requirement is that you get tested. So
More people might be vaccinated and also go get tested.
absolutely. We know of several departments that are just, because of the nature of what they do, their employees just want to get tested weekly, regardless if they're vaccinated or not. So that's another good point. Yeah. So yeah, it seems the repercussions of mandatory testing is shaming those who do not want to disclose. No, I disagree. Again, there's going to be a ton of people who are going to be, just like Dr. Phaeton said, who are going to be in line, who are going to be participating in this because they want it. That was one of the, we were thinking that, to be honest, we didn't realize that there would be a big demand for the vaccinated, those who had provided proof of vaccination as well, who still wanted to be tested. And so that there's a significant interest among the TW community for that. So I disagree with that statement.
Matt, I don't know if we covered this before, but if someone has already uploaded their their proof of vaccination, when should they expect to receive some kind of verification that it's been received?
Tanisha, for student health services, I'm not sure exactly how that's being handled. I don't know that you were sent. I think if you were vaccinated or uploaded it, if student health services didn't tell you that you needed to provide something additional, I think you're good. Is that right, Tanisha?
Sorry, if you've already uploaded to us, you are clear and good to go. If you have, if there was an issue with what you uploaded, we've already emailed and communicated to
Okay.
you.
So no news is good news as far as student vaccinations. Perfect. I think we've already covered that one. I answered that one. I'm not sure I understand this question. Then they can't take the place of those who do not want to test. I assume that's in response to saying that individuals who are vaccinated are also wanting to test. We should have plenty of capacity. We're going to have 10 lines. Well, I was going to say 10 lines, no waiting, but we're going to have 10 shoots, so to speak, in Denton. So I don't think it will have a problem with capacity. And so it's not an either or, it's whoever wants to. Looks like Dr. Grant already answered one that was a response to. Okay. Well, now we're getting closer to the time, but there's still time if folks have some questions. I will say you can always reach out to risk management or any of us if you have questions that you'd rather get into more detail or feel more comfortable talking one-on-one with. That's always an option. I'll say the risk management email, risk@tw.edu. If you have a question, you can always email there as well. All right, well, it looks like we don't have any more questions in the queue. We'll give it a few more minutes because we were due to end at 5. But if I don't see anything in a minute or so, we'll go ahead and end it. All right, well, I don't know about a couple minutes, but that's about as long as I'm going to wait. Oh, here we go. Statistics show that obesity is a leading comorbidity of COVID. Are we going to stop selling fast food on campus? Yeah, I don't think that's going to happen. But certainly we have a lot of, what am I trying to say? Health and wellness, the wellness, thank you, the wellness initiative. So there's certainly a lot of encouragement on campus for healthier choices. So the fast food comment, I would say that there's folks who like fast food and you can have it on campus. Yeah. We're not forcing you to eat that. Yeah. You don't have to get tested, but you have to have an exemption. So there are choices. I feel like we've covered this one at this point. Don't agree that it's coercion. You know, it's something that's necessary to be done in order to protect the campus, and there are options. Okay, well, a couple more beats and then I think we'll end it since there's not a lot of questions left. All right, well, I do appreciate everyone attending and I appreciate the questions. And hopefully we've answered your questions. And if you have more, you can always reach out to risk management or any of the other folks on this panel. So, all right. I think we'll just, we'll end it then. Thank you for attending.